All my life, I've been committed to patients. It all started in our big, big family. I have 10 brothers and 5 sisters. And me looking after the sick kids. And it ends up here, all now, in front of you, promoting the patient's cause in the big, big, big TEDx family. As the new first female member of the board of the Radboud University Medical Center, my goal for the patient is not partial, but total partnership. And what I want to share with you today is where we stand at present and where I would like us to go. I joined Radboud 6 months ago, and as an introduction to the center, I participated in a lot of patient activities, and I've been trying to see everything through their eyes. And what I saw was amazing. Many fantastic things are happening in our hospital. And you saw them this morning. You saw the people of us speaking and showing what we are doing there. What a dedication doctors and nurses have. What a compassion they show. And what a vibrant patient communities I saw. And what an impressive patient outcomes I've observed. I'm proud, really so proud, being part of this Radboud family. But there's also a flip side. I also saw patients when doctors did their grand rounds, laying in their beds, all alone, without a loved ones, passive, listening to a complete medical monologue. And the only thing I heard him say was, "Yes, doctor. No, doctor. Oh, doctor." Sure, they were granted a very central position. Sure, all the medical staff surrounded them, dedicated to solve their problems, focused on that patient. But what do you think? Are these patients in the driver's seat? Is this the way we treat the most valued member of our team? No, it's not. We have taken over the command of their disease, of their treatment, and maybe even of their life. So, this is what I would argue against. Argue against. This is not what we mean by participatory healthcare. So, what can we do about it? About this enormous problem? Lucien called me and asked me, "Cathy, would you like to follow a mother of a 6-year-old child who was to be operated on for the 31st time, imagine, 31st time, and her child has spina bifida, and she sharing all her feelings of frustration and anger and despair, but also strength, hope, and appreciation of our staff with a huge amount of followers. And followers of followers, you know, retweeting and so on. And I introduced myself to her. And perhaps you can wave with me, because she is now watching us. Can you help me? Jita and Rob, you are with us in our thoughts. Imagine her living with us for a full 2 weeks without any interruption. She observing us, of course, from her perspective. And she perceiving our hospital, after all these admissions, as her second home. And what did I learn? I saw nurses taking over all the medical activities she was used to doing herself. I saw also that she wanted to be in touch with the treatment team to discuss the pain protocol in advance because she knew her son would be in great pain. And once returned home again, I saw a Twitter request for help because she couldn't get in touch with her own doctor when her son developed a serious complication. So, these situations learned me that something has to be changed. Okay, you may ask me now, what are we supposed to do? Giving our phone numbers to our patients? Follow our patients? Why would we do so? Okay, the why question. I should have been asked this question before. Simon, I apologize. The question. But it was quite obvious for me. Okay, why? Because patients are the only experts in having their diseases. Because it has proven to be more effective and even more cost-effective to involve patients in their own care, shared decision-making, you know, and so on. And above all, we all feel better when we treat patients like we would be treated ourselves. The golden rule, you know. Okay, you may ask me now, and you, what have you done in the meantime? In the Radboud University Medical Center. Okay, we've spoken about it. And the heads of the departments that treat patients with chronic diseases are going to change. They are going to create a climate in which patients can help us to improve healthcare. And in fact, they are going to develop contracts in which expectations are translated in agreements also about the medical performances and activities. And secondly, they are also going to invite patients to the meetings. So simple as that. And they are also going to guarantee contact options for patients to their own doctors, if needed. So, let's hand control back to the patients. Let them put in a position of equality. That's what total partnership means to me. In a world that is changing faster than we can imagine, blurring inside out and outside in. We have woken up, we have spoken up, and now we act up. We, Melvin, Paul, Kees and I, members of our board, we believe that we can inspire you as patients, as well as care professionals, to help us to improve and to follow us. So, either use your heart or lose it. Let's do it together and feel all right. Enjoy and join our family. Thank you.